One of the common conditions we treat in the office is shoulder pain. And a typical history might go with someone coming in saying, well, I've had this for 4 or 5 months, I don't have this single mechanism of injury, and it's just gotten progressively worse. And now they're having pain with activities, or maybe getting dressed, having pain in the shoulder at night. And the question always is, well, I don't remember doing anything, what causes? Oftentimes it isn't anything but more of the same. If we're at a desk, we spend a lot of times in a forward position like this. Or any of the handheld devices now, again, prolonged flexion, and this is this forward position. And we become limited with extension. And that sets up an environment where we start to get irritation more on the soft tissue structures. So if we look at the shoulder girdle, there are really only 3 bony structures. There's the arm, the shoulder blade, and the collarbone. The rest of it rely heavily on the soft tissue such as rotator cuff tendons, pecs, deltoid, and the mid-back muscles. So when we start to lose proper mobility, whether it's in the mid-back or scapular mobility, for every 1 or for every 2 degrees this arm moves, that shoulder blade needs to move 1. And if these muscles are tight, they're going to set up an environment where they're going to cause increased irritation on the rotator cuff. So sometimes it's manifested at the rotator cuff as far as the increased wear and tear, but we can have dysfunction in the mid-back or neck that really leads to the extra wear and tear on the rotator cuff. So what we like to do is we talk to people when they come in about proper biomechanics. We might have people come in and say, well, I started some strengthening exercises and consequently I've only gotten worse. Again, that would be something that is well intended, but if we don't regain pain-free range of motion and flexibility and mobility, and we start to introduce strengthening, then we're going to make things worse. So if you feel like you're starting to develop shoulder problems and it hasn't subsided, and you have any questions, give us a call. We'd be happy to go over some things that you can start to do at home and hopefully kind of nip this in the behind before it becomes a bigger issue.